Let us understand the investigations performed for the diagnosis of rheumatic heart disease. First is throat swab culture. Throat swab culture is a test in which a sample is collected from the back of the throat using a sterile swab to detect bacteria or fungi. Here we look for group A streptococcal bacteria. Second is anti-streptolysin O test. It is a blood test that measures antibodies produced in response to streptococcal infection, especially done for gas bacteria. The next test is ESR test, that is erythrocyte sedimentation rate test. It is a blood test that measures how quickly RBCs settle to the bottom of the test tube over an hour. In the presence of inflammation, proteins clump together, making the cells heavier and thus causing them to settle faster. C reactive protein. C reactive protein is a blood test that measures the level of C reactive protein in blood. This C reactive protein is produced by liver in the response to inflammation. And at last, complete blood count. Complete blood count is performed to check the elevated WBC and RBC count. The next test is echocardiography. It detects the chronic valvular damage, that is mitral regurgitation or stenosis, and it also verifies if aortic involvement. Then electrocardiogram ECG is used to check for prolonged PR interval. Here electrodes are placed on the chest of the patient and it indicates the presence of myocardial inflammation. Next is chest X-ray. It identifies the cardiomegaly, that is enlargement of heart. It is essential to identify the carditis in patient, or it also helps to understand pulmonary congestion. N-terminal pro-B-type necrouretic peptide test is a blood test used to evaluate heart function, especially in case of heart failure. Other examinations such as skin inspection to check for nodules, erythema marginatum, neurological evaluation for chorea, joints examination for polyarthritis, abnormal sounds of heart and vital signs are to be performed.